36-year-old Lauren Pasticas has been struggling with depression since her teens. She has taken antidepressants, but it wasn't until she tried ketamine, she says, she finally started feeling better.
It's kind of like a reboot for your life. It's like a restart button.
Ketamine, a longtime anesthetic used for animals and humans, is now increasingly being used to treat depression. Also known as the illicit club drug Special K, studies show it can provide relief for some depressed and even suicidal patients.
Usually these patients have been on 3 to 4 medications with minimal effects. They've been in therapy, usually an average of at least 10 years. And are still having thoughts of suicide.
Clinics offering ketamine infusions are opening up around the United States. Even though ketamine is not FDA approved to treat depression, doctors can prescribe medication for off-label uses.
The effects are pretty dramatic, and whereas SSRIs take 3 to 4 weeks to start working, we can see immediate effects in up to 1 to 2 hours.
More than 300 million people worldwide have depression. Conventional antidepressants take weeks or months to kick in and don't work in about 1/3 of patients. Despite the high hopes around ketamine, some doctors say it should be used as a last resort treatment and are urging caution since the long-term risks and benefits are unknown.
It does have very rapid effects on things like heart rate and blood pressure that could put some people at risk to exposure to it. We also know that it has effects on the way people think and even perceive things. So it can be quite a scary medicine for some people to take.
There are no standard doses for ketamine, so clinics make up their own regimens. Infusions can take 45 minutes. Some patients report euphoria and hallucinations during treatment. Without regulators' approval, many insurers won't cover ketamine for depression, which can cost thousands for multiple infusions.
Just because the FDA hasn't approved it doesn't mean anything to me. It's worked for me. That's why I'm here.
For Pasticas, the experimental treatment has been worth it. Dozens of studies are now underway to understand more about ketamine. Kathy Young, Associated Press.